This morning, I watched a video with a shocking title. This morning habit silently raises stroke, risk after 60. And I have to speak up. Because I'm a brain doctor, a neurologist who's spent over 30 years treating stroke patients, memory decline, and blood flow issues in older adults. I understand how scary it feels to wake up dizzy, with your heart racing or your balance off, but here's the truth. That video exaggerated nearly everything. And if seniors take it at face value without context, they might follow advice that does more harm than good. Drinking coffee in the morning isn't automatically a threat. Eating oatmeal doesn't instantly spike your blood pressure. And standing up from bed doesn't trigger a stroke unless there's an underlying issue. These blanket statements need context and science. So today, I'm going to walk you through that viral video, one habit at a time, to explain what's accurate, what's misleading, and what older adults actually need to know to protect their brain health every morning. If you care about brain health or simply want to start your day with clarity and confidence, stick around. And if you find these honest medical breakdowns helpful, leave a comment, hit that subscribe button, and share this with someone you love. Because you deserve real facts, not fear. Let's start with the first so-called dangerous habit, getting out of bed the moment you wake up. The original video claims that this one move can quietly set you up for a stroke, especially if you're over 60. Now, I treat stroke patients. I work with older adults every single day. And I understand the concern, sudden drops in blood pressure, dizziness, even falls. But let's be honest, this idea needs more clarity. What they're referring to is something called orthostatic hypotension. That's when your blood pressure drops temporarily when you stand up too fast after lying down. It can cause a head rush, tunnel vision, or a moment of unsteadiness. And yes, that can be uncomfortable. In some cases, it's even dangerous, especially if someone loses their balance and falls. But let's not jump from dizzy to stroke. A brief head rush in the morning isn't a mini stroke. It's your body doing what it's designed to do, adjusting to gravity. When you're lying down, blood pools a bit in your lower body. The moment you stand, your cardiovascular system needs to push that blood back up to your brain. If it's slow to respond because of age, medications, or dehydration, you'll feel it. But that doesn't mean your brain is in danger of permanent damage. Now, could this be a warning sign of something deeper? Possibly. If it happens every day, or you feel faint, or your vision blacks out, yes, that's worth discussing with your doctor. But the solution isn't panic. It's pacing. Take a moment before you get up. Flex your feet. Sit at the edge of the bed. Give your body time to shift from rest to alertness. This isn't a stroke-proof routine. It's just common sense, and something many older adults already do naturally. My concern is that exaggerating this moment into a life-threatening risk creates unnecessary fear. Some seniors may hear that message and become afraid to even get out of bed. They might avoid movement. And ironically, that kind of inactivity creates its own health risks, like loss of muscle, poor circulation, and cognitive decline over time. Let's encourage safer mornings, not scarier ones. Stand up slowly, be mindful, but know that your body is more resilient than you've been told. And while we're on the topic of morning routines, let's move to the second habit that sparked even more confusion, drinking coffee before water. Does it really thicken your blood and set you up for a stroke? Let's find out. The second habit mentioned is something most of us can relate to, reaching for coffee first thing in the morning. The video warns that skipping water and heading straight to caffeine can create a perfect storm in your bloodstream. Thick blood, constricted vessels, and a heightened stroke risk. That sounds dramatic, doesn't it? Now, let's separate the truth from the fear. After a night of sleep, your body is mildly dehydrated. That's natural. You haven't had any fluids in 7 or 8 hours, so your blood volume may be a bit lower and your circulation slightly slower. Starting the day with water is a smart idea, especially for older adults whose blood vessels may not adjust as efficiently. But does skipping water and drinking coffee first actually cause your blood to thicken in a way that leads to stroke? The short answer, not likely. Not from 1 cup. Not unless you're severely dehydrated to begin with. What caffeine can do is temporarily narrow your blood vessels. It's called vasoconstriction. For some people, especially those who are sensitive or already hypertensive, this can raise blood pressure or cause a jittery feeling. But again, that's not stroke territory, it's stimulation. Now, if someone is drinking 2 or 3 cups of strong black coffee on an empty stomach every single morning with no food or water in sight, that's a different story. That could lead to rapid heartbeat, acid reflux, or blood pressure spikes in those who are vulnerable. But the issue isn't coffee itself, it's how and when you drink it. Here's what I recommend to my patients. Before your morning brew, have a glass of room temperature water. Just 1. It helps rehydrate your system, supports circulation, and wakes up your digestion in a gentle way. If you want a little more benefit, add a squeeze of lemon or a pinch of mineral-rich salt. But even plain water does the job. Then go ahead, enjoy your coffee. Ideally with a small bite of food, which we'll get to in a moment. Because the idea that coffee itself is dangerous is misleading. Numerous studies actually show that moderate coffee intake may reduce the risk of stroke and cognitive decline in older adults. The key, again, is moderation and context. Let's not villainize a routine that brings comfort, alertness, and joy to millions, especially when the real risk isn't the coffee, but chronic dehydration and poor circulation habits over time. So the takeaway isn't to fear your morning coffee, it's to respect hydration. Start with water, then sip your caffeine slowly, ideally after eating. That small shift can make a big difference in how your body and your brain handle the start of the day. And speaking of breakfast, this next part is where the video takes a surprising turn, because it suggests that your so-called healthy morning foods, like oatmeal and whole grain toast, might be silently sabotaging your arteries. Is there any truth to that? Let's look closer in the next habit. The third habit the video points out is something that surprised many viewers. The idea that your seemingly healthy breakfast, like oatmeal toast or a bran muffin, might actually be flooding your body with hidden sodium, stiffening your arteries before your day even begins. Now, let's be honest, that sounds concerning. And in some cases, it can be. But only if you're eating the processed version of those foods, and only if you're doing it every day, without knowing what's actually in them. Let's start with oatmeal. There's a big difference between plain rolled oats and flavored instant oatmeal. The latter often contains added sugar, flavorings, and yes, salt. Some single-serve oatmeal packets can have 200 to 300 milligrams of sodium or more. Stack that with salted butter on toast or a slice of deli turkey, and you could easily reach 600 milligrams of sodium before 9 a.m., especially if you're not paying attention to labels. But here's the part that needs to be said. Sodium isn't evil. Your body needs it. It helps regulate fluid balance, nerve signals, and muscle function. The issue is excess sodium over time, especially in people with high blood pressure, kidney disease, or cardiovascular conditions. It's not about that one breakfast. It's about patterns. So does eating oatmeal in the morning put your brain at risk? Not if you're using whole oats and not drowning them in prepackaged flavorings or processed toppings. In fact, oats are a heart-healthy food, rich in soluble fiber, and have been shown to help lower cholesterol and stabilize blood sugar, 2 major factors in stroke prevention. The same goes for toast. Whole grain toast made at home isn't the problem. It's when we reach for commercially baked protein breads, flavored bagels, or processed muffins that the sodium starts to creep in. For my patients, I recommend a simple principle. Aim for under 300 milligrams of sodium in your first meal of the day. That's not difficult. Rolled oats with berries, a boiled egg, and half a banana? Perfect. Add a small slice of whole grain toast if you like. Just skip the deli meats, the boxed mixes, and the frozen sandwiches. Breakfast doesn't need to be bland. It just needs to be intentional. And most importantly, it should help, not hinder, your brain function. So again, the core message isn't wrong. Watch out for hidden sodium. But the way it was framed in the video makes it sound like your breakfast is setting off a neurological time bomb. That kind of message causes unnecessary guilt and makes seniors second-guess foods that are actually good for them. Now let's move to the next part, because this is where the video really leans into fear. Drinking black coffee on an empty stomach, they say, causes a 60% adrenaline surge and tightens your arteries. But is that true for everyone? And if so, is there a better way to enjoy your coffee without shocking your system? Let's talk about it next. Now we come to coffee again, but this time it's not about skipping water. It's about drinking black coffee before putting anything in your stomach. The video warns that doing this can cause a dramatic 30 to 60% surge in adrenaline, constrict your arteries, and make your heart pound. Sounds intense, right? But let's slow that down. Caffeine is a stimulant. That's true. It works by blocking a chemical in your brain called adenosine, which normally makes you feel tired. By blocking it, caffeine wakes you up and increases alertness. It also stimulates the release of adrenaline, the fight or flight hormone, which explains that energized, even jittery feeling some people get after their morning brew. Now, when you drink coffee on an empty stomach, the effects of caffeine can be more noticeable. Your body absorbs it faster. And without any food to buffer the impact, you might experience a sharper spike in heart rate, acid reflux, or even anxiety. But does this mean you're damaging your arteries or triggering a stroke? Not likely, unless you already have a serious underlying condition or you're consuming very large doses of caffeine. In fact, for many people, especially those who've built up a tolerance, black coffee on an empty stomach doesn't cause any issues. But for older adults, the situation can be a little different. As we age, our sensitivity to caffeine can increase. Our stomach lining becomes more delicate. Our nervous system doesn't regulate quite as smoothly as it once did. So if you're experiencing racing heartbeats, lightheadedness, or nausea after your first cup of coffee, it might not be your heart or your brain. It could just be your empty stomach reacting to a powerful stimulant. What's the fix? It's surprisingly simple. Eat something, anything, before you drink coffee. This doesn't mean a full breakfast. Even a few almonds, a small piece of toast, or half a banana can be enough to create a cushion for your stomach and slow the absorption of caffeine. I call it the buffer bite. It's a small act of kindness to your body that can prevent a lot of discomfort. And if you're having multiple cups of coffee before 9 a.m., consider cutting back. 1 cup, about 150 milligrams of caffeine, is generally well tolerated. More than that, especially early in the day, may not give you more energy. It may just give you more stress. So no, black coffee isn't your enemy. But how and when you drink it matters. And if you've been blaming your morning palpitations or jitteriness on age, the real culprit might just be the order in which you do things, not the coffee itself. Now, while this one is more about comfort than danger, the next habit the video highlights is far more serious. It's about those tiny warning signs your brain might be sending you, things like slurred speech, tingling fingers, or momentary confusion. The kind of symptoms we often brush off as just waking up groggy. But what if there's something much more urgent? Let's take a careful look at habit 5. Because ignoring these signs, that's a risk no one should take. Now we arrive at what I consider the most serious point in the entire video, and surprisingly, it's the one I agree with the most. It's about the small, quiet, easy-to-dismiss symptoms that can appear during the first hour after waking. A word that comes out garbled, a moment of confusion, a weak grip, or a finger that feels numb for no reason. The video calls these red flags, and they are. These moments aren't just grogginess or "I haven't had my coffee yet." They could be your brain whispering that something's wrong, and in some cases, they're not whispers, they're alarms. What we're talking about here is a transient ischemic attack, or TIA, sometimes called a mini-stroke. But I don't like that term, because there's nothing mini about it. A TIA happens when blood flow to part of the brain is blocked temporarily, usually just a few minutes. The symptoms are similar to a full stroke: slurred speech, numbness, trouble seeing, difficulty walking, weakness in one arm or leg, or even just feeling off. But then, just as suddenly, they go away. That's the danger. Because when symptoms disappear, people assume everything's fine. They brush it off. They go back to their day. But a TIA is often the brain's rehearsal for something worse. 1 in 3 people who have a TIA will go on to have a full stroke, often within 48 hours. That's not fear-mongering. That's fact. So what should you watch for? I teach my patients the fast drill. F for face. Is one side drooping? A for arms. Can you raise both evenly? S for speech. Are your words slurred or jumbled? T for time. If you notice any of these, call 911 immediately. But here's the extra challenge for older adults. Not all symptoms fit the textbook. Some may feel just a little foggy or notice they dropped something without realizing it. Others may hear a loved one point out that they sounded weird on the phone that morning. These small things matter. If you experience something unusual, especially if it's one-sided, comes on suddenly and resolves within minutes, log it. Write down the time, what you felt, how long it lasted. Then tell your doctor. Don't wait for it to happen again. Because I've seen too many patients come into my clinic after a full-blown stroke, and when we look back, they'd had warning signs days before. They just didn't know they were warnings. Now, this doesn't mean every stumble, fumble, or brain fog is a TIA. Far from it. Aging brings slower mornings. Some of that is normal. But when it feels different, sharper, more one-sided, or just off, it's better to check than to guess. So yes, in this case, the video got it right. Ignoring these signs is risky. But let me add something it didn't say. Taking action doesn't have to be dramatic. You don't need to panic. You just need to pay attention and treat your brain with the respect it deserves. Up next, we're going to talk about medications, specifically the common habit of taking all your morning pills at once, sometimes with coffee, and how that seemingly innocent routine could be creating unexpected problems inside your body. Let's take a closer look at habit 6. Let's talk about medication, because this is one habit I see far too often in my practice. The video mentions it briefly, but the implications go much deeper than most people realize. Many older adults take several medications each morning: a blood pressure pill, a thyroid supplement, maybe aspirin, cholesterol medication, or something for blood sugar. It becomes part of the routine. Take all the pills at once, swallow them down with coffee, then move on with your day. It seems efficient. It feels harmless. But in reality, this habit can create serious problems, not because of the pills themselves, but because of how they interact with each other and with what you're drinking. Let's start with the most common issue: coffee. Caffeine isn't just a stimulant, it's also a drug-interacting agent. It can affect how medications are absorbed, how quickly they enter your bloodstream, and how your body responds. For example, certain blood pressure medications, like beta blockers, can be made more potent or less effective when taken with caffeine. The same goes for thyroid medications, which are highly sensitive to timing, food, and fluids. Taking them with coffee can reduce their absorption by up to 30 to 40%, meaning you're not getting the full dose your body needs. Then there's aspirin. When taken on an empty stomach, especially with acidic beverages like coffee, it can irritate the stomach lining and increase the risk of gastritis or even internal bleeding over time. Now, I'm not saying your medications are dangerous. Far from it. These drugs save lives. But only if taken correctly. The solution isn't complicated. It's about timing and awareness. Here's what I tell my patients. Use a pill organizer with clear labels for morning, noon, and evening. Check every label. If it says, take with food, that means after a small meal or snack, not on an empty stomach. If it says, take on an empty stomach, like many thyroid medications, that usually means at least 30 to 60 minutes before eating, and without coffee. For interacting drugs, try spacing them at least 30 minutes apart if possible. I know it sounds like a lot to manage, but once you create a rhythm, it becomes second nature. I've seen patients who felt foggy, tired, or had blood pressure swings every morning, only to realize they were combining medications and caffeine in ways that weren't working for their body. A few adjustments, and suddenly their energy was back, their blood pressure stabilized, and their digestion improved. One more thing. If you're ever unsure, ask your pharmacist. They're a gold mine of information when it comes to medication timing, food interactions, and side effects. Your medications are meant to protect you, but only when taken with intention. Don't let a rushed routine undo what those pills are designed to do. And that brings us to the final habit, the one that might seem the least harmful, but can have surprisingly strong effects on your body. Staying in bed too long, scrolling on your phone, while ignoring a full bladder. It might sound trivial, but trust me, this one has more impact on your heart and blood vessels than you think. Let's talk about habit 7. Now let's talk about something that seems harmless, almost too minor to matter. You wake up, you feel the urge to use the bathroom, but instead you grab your phone, you check the news, maybe read a few messages, scroll through some headlines. 10 minutes pass, then 15. You finally get up, heart pounding, feeling rushed, and head to the restroom. What harm could that possibly cause? Surprisingly, more than you might think. When you wake up with a full bladder, your body is already under mild stress. Your bladder sends signals to your brain that it's time to release. If you ignore those signals repeatedly, several things begin to happen. First, you activate your sympathetic nervous system, the fight-or-flight response. Holding urine causes internal pressure to rise, especially in the lower abdomen. That can trigger a spike in blood pressure and heart rate. For people with sensitive circulation, particularly seniors with cardiovascular issues, this creates a sudden cardiovascular load right after waking, precisely when your system is already trying to recalibrate from sleep. I've had patients who experienced sudden heart palpitations in the morning, not from coffee, not from anxiety, but from simply ignoring the urge to urinate for too long. Second, over time, consistently holding your bladder can weaken the muscle tone of your pelvic floor and bladder wall. That can lead to urinary urgency, incontinence, or incomplete emptying, all problems that become harder to manage with age. Third, there's the risk of falls. When you finally get up, urgently, you may move too quickly, especially if you're holding discomfort. That increases the chance of dizziness, loss of balance, or slipping, especially during nighttime or early morning hours when lighting is poor and reflexes are slower. So, what should you do instead? Simple. When you wake up within 5 minutes, go to the bathroom. Make it part of your non-negotiable morning rhythm, just like brushing your teeth or taking your meds. If you're waking up more than twice a night needing to go, that's something to talk to your doctor about. It could be related to fluid timing, medications, prostate issues, or even sleep disturbances. Also, try limiting fluids 1.5 to 2 hours before bedtime. That small change can help reduce overnight awakenings and give your body more peace during the night. And finally, let your phone wait. The news, the texts, the notifications, they'll still be there after you've taken care of your body. But your heart and your bladder? They don't wait quietly. This isn't about being dramatic. It's about recognizing that even the smallest morning habits have ripple effects. And by choosing better, not perfect, just better, you can build a morning routine that protects your brain, your heart, and your independence. Now that we've gone through all 7 habits, it's time to step back and look at the bigger picture. Because the real question isn't whether you're guilty of 1 or 2 of these, it's what you decide to do about them tomorrow morning. Let's close with a few lasting lessons and a realistic plan you can start using right away. Now that we've walked through each of these 7 habits, I want to be very clear about something. This isn't about fear. It's not about perfection. It's not about making you question everything you do from the moment your eyes open. It's about awareness. Quiet, steady awareness. The kind that helps you make small, meaningful adjustments that support your health. Not because you're scared of what might happen, but because you value the years ahead of you. Waking up slowly, drinking water before coffee, choosing breakfast foods that nourish instead of inflame, paying attention to your body's signals, giving your medications the space they need to work, moving when your body asks you to move. These aren't complicated rituals, they're gentle shifts, and they add up. You don't need a stroke-proof routine, you need a routine that respects your body's rhythm, your mind's clarity, and your heart's capacity to adapt. Because here's the truth I've seen after decades of working with older adults. The people who stay sharp, independent, and energetic the longest aren't the ones who chase perfection. They're the ones who listen, who notice, who adjust, who pay attention to the little things consistently. So if 1 or 2 of today's habits felt familiar, that's okay. In fact, that's good news, because it means you've already recognized the first step, and now you have the opportunity to do something better tomorrow morning. And if this video helped you see your morning a little differently, if it helped you feel more informed, less confused, and a bit more empowered, then I'm grateful you stayed until the end. I don't want to scare you into changing your life. I want to invite you to take care of it. Start small. Maybe it's just adding that 1 glass of water, or waiting a minute before getting out of bed, or finally checking in with your doctor about that moment of slurred speech that didn't sit right. Whatever it is, start there. And if you found this message helpful, I'd love for you to leave a comment below. Let me know which habit you plan to change tomorrow, not to impress me, but to commit to yourself. That kind of quiet commitment can ripple into years of better mornings, stronger minds, and clearer days. And if you haven't yet, go ahead and subscribe, because this won't be the last time we talk about the real issues that affect your health, your brain, and your independence after 60. I'll be right here with you. No hype, no fear, just facts and care. Until next time, take a deep breath and take care of that remarkable brain of yours.